Hi, it's Dr. Sciavolino-Day, and thanks for joining me. I woke up this morning trying to figure out what would be the best topic to start with, and then I realized I sounded a little bit hoarse today, and I was throat clearing and so forth, and then I realized this would be a great place to start because of how common this is. Has it ever happened to you where you wake up and you're talking fine and then all of a sudden you sound a little bit hoarse? Or you're just literally clearing your throat because you feel this glob in the back of your throat. So let's just talk about that. What are what are common reasons? Well, I'm sure it depends on where you're living and things like that. But here in Florida, the top two reasons that I see. First one is regular seasonal allergies. We're having a reaction to something that is outside that is blooming or inside that is within your home, but your body just doesn't like it and starts to produce a drainage or a postnasal drip. It can cause sneezing, but very often it just presents as a dry cough, worse in the morning, although it could happen throughout the whole day. And if you're lucky, then you see other signs like sneezing or having to blow your nose, because then at least it kind of makes you think, this could be allergies. It's a little bit more tricky when it just presents as throat clearing. So usually, if it's just that, and if the story sounds like it could be allergies, I start with a simple antihistamine or some nasal sprays that you can see over the counter. However, quite frankly, there is a second cause that I think is often much more common, and that happens to be related to acid reflux. So with this issue, the stomach is full of acid, the esophagus shouldn't see any, but for many possible reasons, acid starts to creep up the esophagus. It's quite irritating, and it may cause throat clearing. It can cause the feeling of having to cough, and it's a dry, itchy type cough. Or it can even go higher to the level of the larynx and to the pharynx, and I've seen it mimic symptoms of a sinus problem. Lots of drainage, sneezing, blowing your nose, coughing. So it's something that always has to be kept in mind as the possible cause of your symptoms if things just don't improve when you try to treat allergies. So I often tack on something for acid if I see only partial improvement with medications given for seasonal allergies. Unfortunately, it's not always so clear-cut of just being seasonal allergies or just being acid related. It may be a combination of both. So when it comes to seasonal allergies, I try to have everyone be very careful with what's outside, keep the sliders closed, keep the windows closed, making it less possible for these allergens to come in and cause you to have issues. It's a little bit more tricky when it's something that is within your home, such as a pet or dander or carpet or mites in the curtains or things like that. When it comes to acid, well, I hate to say it, a big cause of that is based on what we eat or drink. So common triggers to cause acid to flare up, well, alcohol. So for many other reasons, it's important to always try to keep alcohol to a minimum of 1 glass per day if you can. I know that's not a popular opinion, but in my experience, maximum of 1 would be the healthiest. Next thing, watching out for spicy foods, rich foods, and things like that. We all love to add flavor, but unfortunately, it can also tip the scale and cause you to have some acid issues. Caffeine is another big one. We tend to love to get our caffeine in the form of coffees and teas and even chocolate. But if you can kind of mix in more decaf as opposed to caffeine, that will really help as well. Trying to work on reflux measures is also important, like not lying down for 2 hours after you eat in order to let your body digest what it just ate. Trying to avoid really tight restrictive clothing also is quite helpful. Also, some people sleep with a wedge on their pillow, something that elevates the head a little bit higher, which would make acid reflux a little bit more harder to happen. But if you can work on these risk factors and on these triggers and on these measures, that will help. As a side note, if you do take a medication, because now they're over the counter, medications for seasonal allergies as well as medications for acid issues are all available at your local supermarket. The only thing that I want to remind everyone is that a medication can have a possible side effect, and if you use a chronic medication for acid issues, make sure that you see your doctor to get the appropriate lab testing done, because of the fact of certain medications, especially those for acid, may impact your magnesium level as well as other things. So it's important to get your labs checked every single year. Once again, if symptoms persist, you cannot get rid of them. If they worsen or if you rebound off of the medications, please go see your doctor to get this further checked. Sometimes people do need to see either an ear, nose, and throat specialist or a gastroenterologist to make sure that something else is not going on versus you're not having a complication from what is going on. So always make sure to get checked out and keep up with your annual checkups. Well, that's it for now. I hope this helped. And if you have any questions, then just add a comment and I'll be more than happy to look at that. And I look forward to seeing you next. Have a wonderful day. Bye.